February 19, 1994, Riverside General Hospital in California. It started as a routine Saturday night in the emergency room. But at 8:15 p.m., paramedics rolled in a patient that would turn the hospital into a disaster zone. Within minutes of her arrival, nurses began to faint. A doctor lost control of her limbs. The department was evacuated into the parking lot. Hazmat teams were called in to handle a human body. This wasn't a viral outbreak. It wasn't a gas leak. It was a single woman. Her name was Gloria Ramirez. The world would come to know her as the Toxic Lady. And more than 30 years later, we still aren't 100% sure what happened inside Trauma Room 1. Before the mystery, there was a person. Gloria Ramirez was a 31-year-old housewife and mother of two. Sadly, she had been diagnosed with late-stage cervical cancer. On that evening in February, Gloria was at home when her condition took a turn for the worse. She was having trouble breathing and her heart was beating rapidly. Paramedics rushed her to Riverside General. When she arrived, she was conscious but confused. Doctors immediately went to work. They administered Valium, Versed, and Ativan to sedate her. They tried to help her breathe, but her blood pressure was plummeting. The medical team, led by Dr. Humberto Ochoa, decided to defibrillate her heart. Everything was standard procedure until Susan Minder noticed something wrong. The medical staff noticed an oily sheen covering Gloria's entire body. It looked like she had been dipped in oil and it had a strange, fruity, garlicky smell, like rotten onions mixed with perfume. A nurse attempted to draw blood from Gloria's arm, but the moment the syringe filled, the room changed. The nurse noticed a chemical smell coming from the tube. It smelled distinctly of ammonia. She passed the syringe to Julie Gorchinsky, a medical resident. Julie looked closely at the blood. Floating inside the fluid were manila-colored particles, strange crystals that shouldn't exist in human blood. Julie looked up at the nurse, Susan Minder. Her face had gone pale. She passed out, cold. Dr. Ochoa looked over. Now Julie began to feel nauseous. She felt her face burning. Her legs went numb. She left the room to get fresh air, but she collapsed before she could make it. She stopped breathing. Next was Maureen Welch, a respiratory therapist. She fainted too. Panic set in. In total, 23 people became ill. 5 were hospitalized. The ER was declared a biohazard zone. Patients were wheeled out into the chilly parking lot while staff stripped off their clothes, fearing contamination. Inside Trauma Room 1, only a skeleton crew remained in hazmat suits to try to save Gloria. But at 8:50 p.m., just 35 minutes after arriving, Gloria Ramirez was pronounced dead. The question was, why did her body take the hospital down with her? An autopsy was performed 3 times. The coroner's office was baffled. They found no unknown toxins, no poisons, nothing that explained the mass illness. This led to 3 main theories. The health department's official conclusion? Mass hysteria. They suggested that the smell of the blood, combined with the stress of a trauma code, caused a psychological domino effect. But the medical staff was furious at this suggestion. Julie Gorchinsky, the resident who collapsed, spent 2 weeks in the ICU. She developed hepatitis, breathing problems, and avascular necrosis in her knees, a condition where bone tissue dies. Stress doesn't break your bones. The most compelling scientific theory comes from the Lawrence Livermore Laboratory. Gloria was in severe pain from cancer. It is possible she was using a home remedy called DMSO, dimethyl sulfoxide. DMSO is a solvent used to relieve pain, and it accounts for the garlic smell and the oily sheen on her skin. The theory goes like this. When paramedics gave her oxygen, the DMSO in her body oxidized into DMSO2, dimethyl sulfone. This substance crystallizes at room temperature, explaining the crystals in the blood syringe. But here's the kicker. When they shocked her heart with the defibrillator, the electric jolt may have converted that DMSO2 into DMSO4, known as dimethyl sulfate. Dimethyl sulfate is a powerful nerve gas. It destroys cells and causes convulsions, delirium, and paralysis. If this theory is true, Gloria's body had essentially become a chemical weapon factory generated by a 1 in a million chemical reaction. Even the DMSO theory has holes. It has never been successfully recreated in a lab under the same conditions. 2 months after her death, Gloria Ramirez was finally buried in an unmarked grave. Her family believes there was a cover-up, perhaps a mistake made by the hospital that they tried to hide by blaming Gloria's biology. The cylinder containing her blood has likely been destroyed. The hospital was demolished and rebuilt. The evidence is gone. Was it a rare chemical reaction? A secret hospital error? Or something we simply don't have the science to understand yet? To this day, the case of the toxic lady remains one of modern medicine's most unsettling unsolved mysteries. What do you think happened in Trauma Room 1? Was it mass hysteria, or did chemistry go wrong? Let me know in the comments below. If you enjoyed this deep dive into the unexplained, please hit that like button and subscribe for more true stories that are stranger than fiction.